According to recent guidelines presented by the American Diabetes Association, interval training is being reported as an effective method.
We are Diabetes 101, brought to you by the Korean Diabetes Association, guiding you along the right path of diabetes treatment. Today, we will learn everything you need to know about cardiovascular exercise. While exercise is crucial for diabetes treatment, cardiovascular exercise is our top recommendation. Cardiovascular exercise, does it mean it has oxygen, or does it mean it requires oxygen? What exactly is cardiovascular exercise?
It refers to exercises that require a significant amount of oxygen to generate energy for muscle activities. To use a significant amount of oxygen, you would need a certain amount of time. Hence, activities that engage large muscles or involve rhythmic movements of the entire body are in this category. What do you usually do for cardiovascular exercise?
Except for breathing, I usually walk or ride a bike during the weekend. Are there any other exercises other than what I already know?
There are a lot of exercises as shown in the picture, such as walking, indoor cycling, and standing cycling. These exercises are beneficial for managing your blood sugar, as they improve cardiorespiratory fitness and spend energy for extended periods.
When I start exercising, on the first day, I work hard with passion. And then from the second day, I suffer from heavy muscles. By the third day, it turns into pain, and in some cases, I become sick. When starting an exercise routine, what intensity level is recommended?
When starting an exercise routine, there are a couple of things you should consider, such as how much you should do, how many times per week, how intense the exercise should be, and so on. When planning an exercise program, the most important factor is intensity. As you can see on the screen, there are mainly two methods to choose your exercise intensity. The first method involves using your heart rate, and the second involves rating of perceived exertion. As you can see, we recommend more exercises in the yellow marked area, which corresponds to the moderate to high intensity level. As we know, the heart always beats, even when we are not exercising. The resting heart rate is known to be around 60 to 100 beats per minute. As an example, if a 50-year-old male has a resting heart rate of 60 beats per minute, and he intends to exercise at 50% intensity, he would subtract his age of 50 from 220, resulting in 170. And then he would subtract the resting heart rate of 60 from 170 and multiply the exercise intensity. And then, since this is the intensity of while you exercise, you also have to add the resting heart rate to calculate when you are not exercising, resulting in 115 beats per minute. Therefore, if you maintain 115 beats per minute as you exercise, you can say that you're exercising at 50% of your capacity. Smart bands or smart watches are an easy way to monitor your heart rate as you exercise. The second method is the rating of perceived exertion, which you can use if you don't have a smart band. In simple terms, this method involves describing the level of perceived difficulty you feel during exercise. As you can see the numbers displayed here, this scale was created by Borg. When you add a 0 next to these numbers, it corresponds to the heart rate. In the range from 12 to 14, it is indicated as slightly fatiguing. This is based on the matching of the scale results of people's self-assessment after exercising. Many often marked that they were slightly fatigued within this range. If you exercise within the heart rate range of 120 to 140, it is commonly understood that this corresponds to the slightly fatigued level. Therefore, this scale suggests that engaging in exercise at the intensity where you feel slightly fatigued is appropriate. These two methods are the typical ways to determine your exercise intensity.
I think it could be a bit difficult as everything is in numbers. Dr. Lee, could you provide us with a practical example?
Sure. I will show you the analysis of how I exercised yesterday wearing a smart band. I have set the treadmill speed of 6 km per hour and exercised for about 30 minutes. And as you see in the graph, the warm-up section at the beginning is marked with low heart rate because I walked slowly during that phase. I also did a finishing exercise for about 5 minutes in the end, so within the range that I exercised with a consistent intensity. You can see that the heart rate maintains within the range of 120 to 127 beats per minute. I have engaged in moderate intensity exercise for about 30 minutes, meaning that I have done an appropriate exercise yesterday.
Then we can conclude that moderate intensity cardiovascular exercise is recommended to diabetes patients. Recently, there's a recent trend towards exercise routines known as small habits or atomic habits. Their fundamental idea is that it is better to exercise even just for 5 or 10 minutes rather than not exercising at all. Would there be routines around this level for diabetes patients too?
In the guidelines, moderate intensity exercise is most recommended. It's recommended to exercise at least 30 minutes per session, at least 5 times per week.
5 times? I don't think I can manage to do it.
And if you have been consistently exercising or have built up your fitness, you can also engage in high-intensity exercises. For high-intensity exercise, it is recommended to exercise about 20 minutes per session and schedule it every other day, so about 3 days per week.
Do you actually exercise around 5 times per week?
These days, I can't exercise much due to COVID.
How should I instruct the patients about exercising?
These days, it is difficult to go to the gym and there are various constraints when it comes to exercising. It would be a good idea to find a place to take walks near your home. It could be parks or riversides. Set a place where you can consistently take walks and go out wearing your smart band. Find your appropriate heart rate range and take walks while monitoring your smart band. When you are walking, you will notice the heart rate would not increase as much as you thought. You achieve better exercise results if you keep encouraging yourself to raise your heart rate more, as you continuously monitor yourself through the smart band.
Lately, when I observe patients in the clinic, I can see that due to the COVID-19 pandemic that occurred in 2020, many patients had experienced increased weight and blood sugar. When I ask patients, they respond that gyms close, and during summer they cannot exercise due to storms and the hot weather. When I suggest exercising outside while social distancing, they respond that there are too many COVID cases in their neighborhood, that it is difficult to even exercise outside. Considering that diabetes treatment must be continued regardless, would there be any tips to continuously exercise in our daily lives without being restricted by time, space, or weather?
I've been going to work by my car, but recently I've switched to taking public transport. This was because I wasn't getting enough exercise. So, I suggest switching to public transport could be a way. A professor nearby has her lab on the 8th floor, and she said she always gets there by stairs. This would also be a way to get considerable amount of physical activity.
For me, I would be late if I don't drive.
Yes, that could be a difficulty. Moreover, office workers usually spend their entire day sitting down. It has been reported that they walk about 4,000 per day on average. Average of 4,000 steps means that they don't have enough physical activity in their daily life. According to research findings, moderate intensity exercise is the level of walking at a pace of about 100 steps per minute. This means the daily required exercise amount is walking around 3,000 steps in 30 minutes. If you are an office worker who walks around 4,000 steps per day, it is a good habit to add 3,000 steps to your daily 4,000 steps, aiming for at least 7,000 steps per day.
Lastly, nowadays there are many home workouts that can be done at home. Also, you can get quality information about maintaining good health at home if you use content providers such as YouTube. Like our channel, Diabetes 101. When you watch home workout videos, each set is short, but it is difficult to follow. I notice that there are videos targeting specific areas for fat reduction, like getting rid of belly fat. Would it be okay to recommend these types of videos to diabetes patients?
Yes, they are also effective for diabetes patients. These types of workouts are referred to as interval training. The area marked in blue is the period of when you are exercising, and the area in white is when you are resting. But as you can see, heart rate continues to be at a high level. So even while you are resting, you can get the same effect of exercising. Therefore, interval training is known to yield good results for quickly improving fitness or achieving rapid effects, which is why it has started to become more widely adopted.
Yes, I agree. I've experienced feeling my heart beating quickly, even when I am resting after following the workout sets. It is assuring to know that the heart rate maintains, and you can get exercise effects even while you are resting.
According to recent diabetes guidelines presented by the American Diabetes Association, interval training is being reported as an effective method. However, interval training can be difficult for people who are not familiar with exercising or who cannot control blood sugar. It is better to begin with the traditional method and then attempt interval training.
For interval training, each set was very short. How many sets should you do?
It is best to repeat the sets multiple times. If it's difficult to repeat many times at once, you can consider breaking it down to smaller sessions throughout the day, such as dividing it between morning and evening, or spreading it across morning, lunchtime, and evening.
In conclusion, interval training can also be beneficial for diabetes patients. I am planning to share the practical tips I learned with Dr. Lee with the patients I meet at the clinic.
Exercise is all about putting it into action. I suggest you start right away from tomorrow.
If you found our Mastering Cardiovascular Exercise video helpful, please consider subscribing and liking. Thank you.